Is this my last good year as a health insurance agent? Hello, I am Kevin Knauss, an independent health insurance agent in California. And when I reviewed my income for 2024, I was kind of shocked and surprised that my gross revenue had gone up by 28% over 2023. And so I'm scratching my head trying to figure out what was going on. Maybe I made a mistake in the numbers. And so this graph shows, in 2023, I had a gross revenue from all of my commissions and other income streams of $89,536. And when I totaled up for 2024, I have a gross revenue of $114,170. So a healthy increase. Now, those little numbers on the bottom of 11,000 and 10,000, that is my expenses for both those years. So, of course, that is the gross revenue, but let's look at the net revenue, that revenue which I will put on my Schedule C for 2024. In 2023, gross revenue of $89,536 minus my expenses of $11,021 for a net income from my business of $78,515. In 2024, I'll have a gross revenue of $114,170 minus $10,000 and $309 in expenses for a net revenue of $103,861. And the expenses are, the internet and phone and my insurance and things of that nature. But let's look at where my revenue comes from. In 2024, you can see a big blue chunk there is from insurance commissions from all the different products, the different carriers that I represent. A very small sliver, less than 1% from the book sales. I did publish a new book in 2024. It was a work of fiction, but I'm not, I guess people don't see me as a fiction author, and so that really didn't do much. Google, that revenue is from AdSense, ads that run on my website, insuremekevin.com, and ads that run on YouTube. And that number is a little bit higher than 2023, but $2,300 is, that's about stable. Now, what is interesting is that the revenue from the AdSense, ads on the website, really has decreased. But advertising on YouTube has increased considerably. So it kind of balances one another out. And what that is telling me in terms of, because I can see the views of the website and YouTube, is that more people are turning to YouTube as opposed to just finding text content on the internet to get information about health insurance. So more people are leaning on visual media like YouTube to get information to make consumer decisions. Now, if I take that insurance revenue and break it down into the different segments, it looks like this. So 67% of my commission revenue comes from IFP, individual and family plans. And those are enrollments through Covered California, people that I help enroll into health insurance, what we call off exchange, are direct with the carrier. They receive no subsidies. And so that obviously is a big chunk of my insurance revenue. Next is Medicare, 24%. And those are commissions from the Medicare supplement plans that I help people enroll into, Medicare Advantage plans, and the Part D prescription drug plans. 6% of the revenue comes from the dental and vision sales, and those are, Delta Dental, VSP, either through Covered California or off exchange. And then finally, small group commissions equals 3% of the total. And this relative percentage is very consistent with 2023. So there's no big surprises. It's not like I had one segment that really exploded. I don't really market too much into the Medicare area. Most of my Medicare enrollments are for people generally in covered California that turn 65 and age into Medicare, and then I help them with their enrollment on that side. So then I looked at, comparing those different segments between the 2 years, 2023 and 2024. You can see on the individual and family commissions, it increased $16,638, 29%. So healthy. But why did it go up so much? Well, I'm going to attribute it in large measure to YouTube. I have received a lot more calls from people who have watched my YouTube videos. And of course, there are referrals from family and friends that appreciated my service helping them enroll into a health plan, and then they refer me to their cousins, brothers, and sisters. Dental and vision went up 31%, $1,400. Medicare went up 21%, or at $4,668. And small group went up 88%, $1,800. I picked up a small group in Southern California. So one small group for when you have very few small group commissions, really makes it jump and make it a big item. But overall, so that, all averages out to about 28% increase in the revenue. And it looks like it was primarily due to the individual and family market enrollments, primarily through covered California. So in case you think I am rolling in cash, or any small business person, sole proprietor like myself, I paid $29,800 in estimated tax payments to the IRS and California during the year. And I haven't received a refund on any of my tax returns for 10, 15 years. So I probably will be paying a little bit more. So that's just the beginning of my tax bill. So, that's a good chunk. Now, that's just income that you can't spend on other things. It just goes to the government. But when I saw that big increase between 23 and 2024, I decided to look at what my income has looked like over the years since I became a health insurance agent, which I started actively doing in 2011. And you can see 2011 and 2012, my income was zero. My expenses were greater than any revenue I generated. And then my revenue exceeds my expenses. In 2020 and 2014, Covered California comes along. I'm starting to get more of the individual and family market. And then I was surprised that in 2019, I didn't know that my income dipped like that, but it must have. And then it jumps up to $53,000 in 2020, and then up to $103,000 in 2024. So that was healthy, but I'm wondering if that's the high water mark for my earnings as a health insurance agent in my career, because there are some challenges in 2025 and beyond. For 2025, one of the health plan carriers has announced that they're cutting commissions by 40%. And I have more and more people enrolled in this health plan, so that's going to be a hit. I just don't know exactly how bad it's going to be, but it's definitely going to decrease my individual and family plan commissions because of that big commission cut. There's also another health plan that has refused to pay me commissions for 2024. It's kind of a technical issue. There's not a whole lot I can do about it. Hopefully other carriers won't pick up on this technicality and say, oh yeah, we can cut all these other people's commissions too. Medicare, at the beginning of the annual enrollment period, October 2024, many of the Medicare plan sponsors came out and said, we're not going to pay a commission this year. And that was after many agents like myself had spent 10, 16, 20 hours studying to get all our certifications, get prepared to help people enroll in these Medicare Advantage and Part D drug plans. And the plan sponsors just came out and said, no, we're not going to pay a commission. So that was a lot of labor on my part and many other agents, and we will realize the bitter fruit of that in 2025 when our commissions for, primarily for me, the Part D drug plans just goes away because so many of the plan sponsors aren't paying commissions, and then also on some of the Medicare Advantage enrollments. So I'll probably pick up some additional Medicare supplements and Advantage enrollments during the year. I don't know if that will make up for the commission loss because of the cut in commissions. Then, of course, it won't affect 2025, but in 2026, who knows what's going to happen with the Affordable Care Act. At a minimum, I can see the federal government allowing the expanded subsidies that were put in with the American Rescue Plan in 2021 to expire. So that means the generous subsidies that people have been receiving, especially if you had an income over 400% of the federal poverty level, that will go away. And that will really put a pinch on a lot of individuals and families, and they may just do away with their health insurance enrollments. I can easily see 30 to 40% of my book of business just going away if the expanded subsidies are allowed to lapse and we go back to smaller subsidies, because health insurance premiums have gone up fairly healthy. So if the subsidies are cut too much, people just won't be able to afford the health insurance. And then if they radically change the Affordable Care Act, I may lose additional enrollments. Hopefully California will do something, but we really don't know. So when I look at the landscape of 2024, what's coming in 2025 and 2026, 2024 may have been my best year, and I may not be around in 2026. Hopefully Medicare and some other things will keep me going, but 2024 may have been my best year as a health insurance agent in California. If you have any questions or comments, you may leave those down below, and I will do my best to answer them and respond. Otherwise, for InsureMeKevin.com, I'm Kevin Knauss.